Hi, I'm Sarah Dickens. I'm the now Deputy Director of Research and Innovation at KMPT. And I'll let Arti introduce herself shortly. I suppose the purpose here is, again, it's about a journey for a relatively small research organisation and how we've kind of at least started the journey for ourselves. And so our first question should probably be why now, why we're here. And again, it's echoing everyone else's the situation of a COVID pandemic in 2020, and then the murder of George Floyd in such a short amount of time as well. It threw up inequality into such a visceral place that meant a group of us in the team, we set up this undefined group of allies and those from diverse groups. So which also, Julian, thank you for you're talking about the word ally, because it's something I've really struggled with on a sort of a low level, and I've never understood why, and now I understand why I don't like the word ally, but didn't have a better word for it, so thank you. And it then led, so we were a group talking about EDI in research and how we could use that emotion and our reaction to actually change something within our control. And then the following year, we refreshed our research strategy. So it gave us an opportunity to be more strategic about things. And then that also coincided with getting a pot of money from the CRN to focus on PPIE. And then also with Arti getting a place on the UKRD Inclusion Working Group. And that kind of created just that time and space and direction that actually led us to be able to do something more meaningful. And I will hand over to Arti, who has done amazingly meaningful things for us.
Thank you, Sarah. So I guess to talk about the meaningful things that we're trying to do in KMPT, I guess initially the first thing I wanted to talk about is our kind of demographic spread. So on the surface, Kent does seem like a majority white group. I think when I was looking at the data in terms of the diversity spread within Kent and Medway, it does seem quite limited. It is very, very like a majority white area. But I think when you dig in a little bit deeper, there are pockets of underserved populations within this region. So, for example, this ethnic diversity, you know, we're a coastal area, so that comes with areas of social deprivation, and we have migrant communities in this area too. We also have traveller communities and, quite a homeless population as well that deserves some attention and care as well. So I think in terms of defining our focus, we wanted to be led by our population. So who is it that really needs help here? Who is underserved? Who is underrepresented within Kent and Medway? And that kind of drove some of the work that we wanted to do. So I suppose, like, once we kind of understood the local population, we also wanted to develop our pledge to improve inclusion in research. And within that, some of the work that we wanted to undertake is kind of around defining our key priority areas. So what is it that we want to focus on? And how do we intend to be able to do that? And I think the way that we're able to do that is by looking at local and national resources. So we've already talked here a lot about the various resources that are available, the fact that the HRA, the CRN, the NIHR are focusing a lot of their attention on EDI and promoting equity in research. And so it's kind of drawing upon all of those resources and seeing how they can be implemented within each individual trust, which is what's important. And again, I know we've talked a lot about resources as well, but I suppose one of the things that was really important for us in kind of developing our pledge is identifying the resource requirements. So I know, again, we've talked a lot about dedicated time, funding and commitment in order to be able to take some of this work forward. And I'm echoing that essentially, that in order for us to kind of prioritize this work, there needs to be protected time. There needs to be a collaborative working group that kind of focuses on this area and then wants to push this work forward. So so in order to understand how we've put all of this in practice, I suppose I also wanted to give a brief run through of the current projects that we have, that we're currently working on at the moment. I won't give a huge amount of detail about each of these, but for example, a couple of the studies that I wanted to pull focus on specifically is around improving access to people with learning disabilities and neurodivergent needs. That's a project that I'm leading on with my colleague Ellie Rabbit, who is a learning disability expert by experience. There's also another project that's being run by a professor at our kind of joint medical school, and that's around kind of increasing representation and participation of Sikh people. My colleague Philippa is also doing some work with people who have comorbid physical and mental health problems. And that we have another clinician within our trust who's working on barriers to accessing perinatal mental health among the traveller community. So I suppose there is a really wide spread of projects that we have going on. Not all of them have a core focus on ethnic or race equality, but at the same time, I think, as I said, we're being led by our local population needs at this point. And we've identified that these are specific underrepresented groups that we wanted to work with. The two things I wanted to highlight within this kind of list is the inclusion of people who are experts by experience. So in every single one of these projects, there is a lived experience expert who's involved, who is kind of co-producing some of the content that we're kind of trying to develop, who are co-facilitating consultation groups, who are co-developing materials. So a lot of this work is being done with people rather than to people. And also it's given us an opportunity to collaborate across local trusts and universities. So again, we wanted to do a lot more joined up working and ensure that we're working with other trusts. So we're able to provide appropriate support. Aside from the projects that we're also that we have kind of been running, there are specific processes that we're implementing within our R&D department. So for example, when we are screening studies that we are either opening or are developing, we're identifying there's a specific higher weighting that we're applying to studies that are aimed towards underserved populations. And that's allowed us to identify the range of projects that come to us, either whether they're in development or being hosted, that have a specific focus on these underrepresented groups, and also allows us to kind of focus our time and attention to those projects as well, which I think has been really useful, just to kind of understand the sort of projects that are coming to us and to understand whether there's more that we could do to support them. We've also started examining our engagement practices to understand how current processes affect underserved groups. So for example, one of the things that I've come across very recently is around our payment processes. And I know there's a big discussion around paying people who are currently on benefits and the concerns that they may have. And I think some of these are echoed in, they're just important for us to understand, I guess, when we're working with underserved populations. And also, I know we talked kind of around translated documents and things like that. And I think that we're doing a little bit of work on easy read documents at the moment, but also I think that there is an important focus for us to work on translated documents and work better with our translational services in order to make sure that our processes in terms of engagement are accessible to everyone. And then finally, we're thinking about ways that we can improve how we communicate research updates to a diverse audience. So we're also thinking about different ways that we can engage with people. So obviously we try and use social media quite regularly, but are there videos? Could we do more shorter videos around these kind of topic areas that have subtitles for people who prefer to read content? Is it better, rather than sending out mass emails and large blog posts that people have to spend time to read, are there better ways that we can communicate with people, especially those who have different communication preferences? So essentially we're trying to implement a range of different elements within our trust and within our R&D department to at least start being more inclusive. So I think this last point, I just kind of wanted to focus on my own closing reflection. So again, I'm very aware that I'm echoing a lot of people here, and that time, attention, and dedication is needed. But I think what's been specifically very, very helpful for me is having open conversations with diversity champions and other organisations. So, for example, being part of this UKRD working group has allowed me to meet Mona. Mona is amazing, and she's offered me like peer supervision almost. So we're going to have regular check-ins so we can share learning between the two organisations and understand how we both work, and if there's anything that can be implemented, or shared between both. So I think this kind of conversation with different people from different organisations is really useful. Again, support and positive reinforcement for the senior leaders. So interestingly, there was something that I wanted to pick up on in terms of this discussion about the term allyship and how it might make people feel. And sometimes it might feel that your ally might have more power, whether that's hierarchical power, whether that's because of the position that they're in, those kind of things. And I understand that it can make people feel a bit difficult, but sometimes for people who are in lower positions, having somebody who is in a senior position, who can be your ally, who can support you to be able to make decisions and to give a little bit of space for leadership or direction can be really, really useful. So I don't want to shy away from the term ally. Appreciative of the kind of power connotations there, but I do think it's important to reflect on that. And yeah, from my position, it is helpful. And then finally, attending events that facilitate learning and reflection. So again, the UKRD working group has been really useful for me to be able to kind of have these conversations in this protected time, but also there's been a lot of other conversations that I've been having with CRN hosted events and those kind of things. So I think it is really useful to keep attending events, even if there's limited time to implement anything. The more events that I attended, the more my mindset started to shift, and the more I felt like I had a voice that should be heard, and I have opinions that are relevant and would be useful to share. So I think it's kind of empowering almost to be with people and to communicate with people who share similar ideas. And so that's our presentation. Thank you very much for listening, and I'm open to any questions.